So without further ado, let me introduce my first speaker, Rebecca Robinson. So Rebecca is a CBT therapist providing BDD teaching at the University of East Anglia for trainee IAPT CBT therapists. She's passionate about increasing understanding of this condition within the NHS mental health services, and as a therapist loves to see how people can reclaim their lives once they begin breaking free from BDD. So Rebecca's going to talk to us today through the common signs and symptoms of BDD, its impact on daily life, and links between BDD and OCD. She's also going to cover treatment options, including medication and cognitive behavioural therapy for BDD. Sounds fantastic. Over to you, Rebecca.
Hello. Hi everyone, thanks so much for joining today and welcome to my part of this webinar. I'm really excited to be sharing with you all. This will be a bit of a whistle-stop tour, but I'll signpost you to some additional resources at the end of the presentation too. And thank you, Kath, for that introduction. That means I can whiz through this first slide. I started my career as a mental health nurse and worked in both acute inpatient and community outpatient settings. I transitioned into CBT therapy because I really wanted to help support people make active and pragmatic changes in their lives, whereas I felt nursing was perhaps a little bit more of crisis management. So I therefore trained as a CBT therapist with IAPT, or NHS Talking Therapies. And in this role, I really discovered my passion for working with OCD and related disorders, albeit I didn't actually come across BDD a lot in my NHS post. But I subsequently, in 2022, specialised working with OCD and related disorders, working alongside Professor David Beale and Dr. Rob Wilson. And BDD has since become a particular passion of mine, having worked with it quite a lot now and seeing the difference it can make in people's lives once they begin to overcome it. So, what is body dysmorphic disorder? Body dysmorphic disorder is a mental health condition in which sufferers have high levels of preoccupation. So that means it's on your mind a lot, struggling to think about other things, and distress around a perceived defect or flaw in their physical appearance. This distress might be around a specific feature or just a more generalized feeling of ugliness or something not being right with their appearance. So there's a reason that BDD Foundation and OCD Action have collaborated today. There is a fair number of similarities in both the two conditions. And in fact, body dysmorphic disorder falls under the category of OCD and related disorders. So how do the two link? Both OCD and BDD have preoccupation, intrusive thoughts, and obsessions as common features. Both disorders present with compulsions. So these can be both mental or physical compulsions. And I'll explain a little bit more about what they may look like later. Well, in fact, I've got it here. In BDD, these tend to be things such as mirror or body checking, trying to improve one's appearance, mentally reviewing, and comparing. And treatment approaches between the two are also quite similar, and we'll come on to treatment in a little bit more detail later on. So it's worth thinking now about how BDD might actually present. So what someone with BDD might be doing or feeling. So feeling distressed and preoccupied about one's appearance is the most common sign. And preoccupation can manifest itself in many ways. Some examples of which might be thinking about the feature a lot, checking the feature. So this could be checking in the mirror or, in fact, any reflective surface. You'd be surprised how many reflective surfaces there are around, even in just your home. by sight. So if it's a feature not on the face, by looking at it physically, checking in your mind's eye, so trying to imagine how it might be appearing, or by hand, so perhaps prodding or feeling the area of preoccupation, and comparing it to others, or indeed comparing the feature to how you felt the feature may have looked on yourself in the past, by comparing to past photographs, for example. BDD usually begins in late adolescence, but often it's not picked up until around 10 to 15 years on from the first onset of symptoms. The most common areas of concern include the skin, so that might be things such as oiliness, pore size, wrinkles, skin texture or redness, nose, so shape or size of the nose, hair, thinning hair, for example, eyes, shape of the eyes, under eyes, chin or jawline, lips, and overall body proportions. People with body dysmorphic disorder might complain of a lack of symmetry, or feel that something is too big or too small, or just out of proportion to the rest of the body. And in fact, any part of the body may be involved in BDD. Another part of the BDD presentation is avoidance. Often, BDD sufferers might have high levels of avoidance. So that might be things like social situations or busy places or being in places with bright lights. People with BDD might go to great lengths to cover their perceived flaw with things such as makeup. At times, makeup application might be excessive. We also might see people redoing their makeup, so not feeling it's right or done well enough in taking it off and reapplying several times over, covering up or trying to distract from the feature with use of accessories. So an example of which could be sunglasses or wearing large chunky jewelry to try and distract attention away from the feature. Or with clothing, so if it's a feature on the body, perhaps baggy clothing to hide it, or dressing particularly smartly, again, to sort of compensate for what they feel is the perceived flaw. And another common feature is reassurance seeking, and that could be gaining reassurance from other people. This could be quite direct, such as asking, do I look okay? Or do you think I look awful? Or does this feature look awful? Or it could be more inadvertent, an example of which could be perhaps making a comment about their own appearance, perhaps with the hope that someone might reassure them. Or self-reassuring, so that could be done internally by telling yourself, oh, maybe I look okay, or trying to look at pictures to reassure yourself that maybe from a certain angle, things look okay. So, getting official now, these are the criteria to be diagnosed with body dysmorphic disorder. And this is according to the Diagnostic and Statistical Manual of Mental Health Conditions, which is basically like a big dictionary of all the different mental health disorders. And here are the criteria for BDD according to that. So the first is a preoccupation with one or more perceived defects or flaws in physical appearance that are either not observable or appear slight to others. And I appreciate the word slight here might feel a bit ambiguous. When does slight become not slight? But I don't want people to get too caught up on that because treatment would look the same regardless, even if it doesn't quite technically meet the remit for slight. The second point is, at some point during the course of the disorder, the individual has performed repeat behaviours, for example, mirror checking, excessive grooming, skin picking or reassurance seeking, or mental acts. So that might be comparing appearance in response to the appearance concerns. Preoccupation causes clinically significant distress or impairment in social, occupational, or other important areas of functioning. And the appearance concern is not better explained by concerns with body fat or weight in a client whose concerns meet the diagnostic criteria for an eating disorder. And I will touch a little bit more on the differences with eating disorders and BDD in a minute. So I just wanted to make mention of muscle dysmorphia, which is a branch of body dysmorphic disorder. So this is a preoccupation with not being sufficiently muscular or lean, sometimes colloquially known as bigorexia, and is characterized by compulsive comparison and checking of one's physique, excessive amount of time spent trying to build muscle, often involving overexertion, training even when injured, for example. It might involve disordered eating, so ritualized meal plans, being meticulous about protein intake, having a schedule around the gym, being prioritized over other areas of life, and sometimes steroid abuse, but that's not always the case. So what are the differences with body dysmorphic disorder and general body dissatisfaction? I'm sure many people can relate to feeling dissatisfied with an area of their appearance. I know I certainly can. But in BDD, the preoccupation and distress levels are extremely high and the impact on life is significant. People with BDD might find it difficult to function or engage with day-to-day tasks, whereas with general body dissatisfaction, people tend to be able to go about their day as normal with little impact. But what I would say is for anyone, anxiety or stress about your appearance is concerning you, even if it feels like it's not meeting the remit for BDD officially, I think it's still worth getting support. So just a quick mention to eating disorders. Naturally, there is some overlap between eating disorders and BDD because appearance can come up in both, and the body is involved in both. However, in line with the DSM-5, so the diagnostic criteria that we looked at earlier, if the appearance concern is better explained by concerns with body fat or weight, or food intake, they would meet the criteria for an eating disorder. The two can, of course, coexist. So if, for example, someone's concerned about body fat, what and how much they're eating, but also has a preoccupation with their skin texture, they can fit criteria for both. We generally recommend to get the eating disorder treated first, just because of the impact that malnutrition can have on a person's physical and mental well-being. So impact on life, and BDD can impact people in several ways and would probably extend beyond this list that I've got here. But some examples as to the way BDD can impact people's lives. It can impact on existing relationships, whether that's through feeling misunderstood or sort of just tensions raised when people want reassurance and perhaps feel they're not getting the reassurance they need. It might prevent people from being able to work, particularly if that's in public-facing roles. It can contribute to a loss of enjoyment in things. When there's really high levels of preoccupation, it can be really hard to be present and in the moment with things that people might enjoy. It can also have a financial impact. This might be due to money spent on cosmetic procedures or skin products. We often see that in BDD, there might be beliefs that romantic relationships or even friendships may not be tenable. And hopelessness and suicidal thoughts are also a common feature, which naturally will have an impact on someone's quality of life. So, prevalence. It's estimated that the condition affects about 2% of people, so 2 in every 100, which is not that dissimilar to obsessive compulsive disorder. Interestingly, the prevalence is much higher in cosmetic settings, with estimates that around 13 to 20% of people walking through those doors would likely meet the criteria for body dysmorphic disorder. BDD can affect all genders. It really doesn't discriminate. We see some differences in that men are more likely to present with concerns about genitals, thinning hair, or body build. People with BDD may be less likely to present in mental health settings because they might not view the problem as a psychological one, but really feel it and see it as being a physical problem, which is probably why I didn't see it much when I was working in the NHS in a non-specialised service. People with BDD are therefore more likely to show up in cosmetic or dermatological settings. So what are some of the predisposing factors? And by predisposing factors, I mean things that might make someone more likely to experience BDD. And these aren't necessarily reasons or specific causes, because often that can be hard to identify, but just some common features that we see within people who experience BDD. So experiences of bullying, and not just bullying about appearance, it can also be just general bullying where people have been made to feel different. Experiencing criticism in any way in early life, whether that's an overly critical parent or teacher. Perhaps having family with overvalued ideas on appearance, whether that's overvalued ideas of their own appearance or critical of other people's appearance around them. People who tend towards perfectionism are more likely to be affected by body dysmorphic disorder. And interestingly, there's also a paper that suggests people who are artistic and creative are more likely to experience BDD. And we suspect this is because of that sense of an eye for detail and attention. So we've spoken about where BDD potentially might come from, but I think it's also important to think about what keeps BDD going, what's fuel to the fire, as it were. So one thing we tend to find keeps people in a position of feeling distressed around their appearance is checking and analysing features. And the reason for this is the more you pay attention to a problem, the bigger it becomes in a person's mind. And actually, this just isn't just the case with appearance. An example I sometimes like to give is if you're writing an essay or project or something, sometimes the more you read over it, the less sense it begins to make, or the more doubt you have that it's any good. It's the same sort of phenomenon. Rumination is another feature that keeps it going, because it keeps the idea of the appearance concern being right at the front of your mind, and making other areas of your life that are important smaller because they're getting less attention. Reassurance seeking tends to keep it going, because often people don't tend to get the reassurance they hope for, or tend to doubt the reassurance they receive. So again, just tends to keep people preoccupied or frustrated or down. Trying to hide or cover the feature can be fuel to the BDD fire. And this is because, I suppose, with anything, the more we reinforce the narrative, the more we tend to believe it. So the more you reinforce the idea of I don't deserve to be seen, or this feature is too bad for anyone to have to witness, the more your brain's going to believe that. And the same rule applies for trying to improve features, whether that's through cosmetic surgery or even just through makeup. One thing to note on cosmetic surgery is we tend to see that people with BDD don't come away from cosmetic procedures feeling satisfied. Either it doesn't turn out as they hope, or they might feel satisfied with it for a short while, but then another feature tends to become the centre of preoccupation. Avoidance is another maintaining factor. The more you avoid something, the scarier it feels. But it also means that people aren't able to connect with perhaps things that they enjoy or important to them, which in turn can reduce mood. And we tend to see that when people's mood is lower, their appearance satisfaction is also lower. And a lack of self-compassion as well can maintain BDD. So in terms of what the treatment looks like for body dysmorphic disorder, CBT is the only psychological intervention that's backed up by research for the treatment of BDD, and that's according to the International OCD Foundation. Several studies have shown a reduction in symptoms through CBT. Although a while ago, there were 2 important randomized control trials that both showed clinically significant improvement. That said, it's still one of the most under-researched mental health disorders. But don't lose hope in that, because there's plentiful research into CBT treatment for disorders that have many similarities to BDD, such as obsessive compulsive disorder and social anxiety disorder. So, in terms of what we aim for in treatment, we first want to look at building a real understanding of the individual's thinking patterns and behaviours that might be maintaining the poor body image. So like we were saying a couple of slides ago, things like focusing a lot of attention on appearance, comparing, ruminating and avoiding. Following this, we'd be really encouraging people to disengage from these solutions, which have become part of the problem, and experiment to see whether their relationship with their appearance improves the less they do these things. We aim to reduce the importance placed on appearance and place more importance perhaps on other areas of life, to generate new information, whether that's about themselves or the world around them, and to tackle avoidance. And a little bit more of an overview of how we might go about this. The first step in CBT would be noting down what is keeping the problem going. And we do this through something called a formulation, which often may be referred to as a vicious flower, and people perhaps in the OCD community might be quite familiar with this. So really mapping out on paper, how is the BDD operating, where does it come from, and what's keeping it going. We'd then look at trying to generate an alternative explanation for the problem. So really trying to see the problem as a psychological one, really looking at what psychological processes are going on, as opposed to focusing in on it being a physical problem. And to do this, we'd do an exercise called Theory A, Theory B, which may be familiar to some of you. We'd also look at reclaiming life by building back routine, focusing on people's values and the things that matter to them, and trying to take people away from focusing and letting their life be dictated to by the negative feelings about their appearance. We'd then look at exposure response prevention, which may be a term familiar to some, and I've got a slide in a minute or so that will go into a bit more detail in that, because it is seen as the gold standard part of treatment. Mirror training, again, I've got a slide on this just to talk a little bit more about that. We may also look at the role of self-compassion and the role of self-criticism. And if appropriate, if there's specific adverse past experiences such as bullying or any specific memories that might be related to how the person is feeling in their appearance, we can do something called imagery rescripting. And I believe there's a separate webinar on that a while back on the BDD Foundation website. So here is an example of the formulation, or the vicious flower that I mentioned. It's called a vicious flower because it highlights a lot of the vicious cycles that people with BDD or in fact any anxiety disorder can often get themselves into. So it looks at things such as narrowing of attention, analysing and ruminating or comparing, checking features, avoiding or hiding or trying to cover features, trying to improve one's features, or avoidance of situations. And I quite like this because it really highlights how temporarily these things might take away those feelings of preoccupation and shame. But what we tend to work on in CBT is how in the longer term, it takes people right back to those feelings and keeps people stuck in a bit of a vicious loop. So that's just a very brief introduction to the vicious flower. So as promised, just a little bit more on exposure response prevention. ERP stands for exposure response prevention. And this essentially means going into feared scenarios and practicing not engaging in BDD related anxiety responses. So this might be going to a social situation and not going to check in the mirror, and trying not to compare yourself in the mirror or not be focused on your appearance and try and keep your focus of attention externally into what's going on around you. ERP is a really valuable tool because it can help people reclaim their lives and gain new information by doing so. And by new information, it might be that people feel surprised that people don't react to them in as negative way as they thought. Or the new information might be, oh, actually, I enjoyed myself so much more when I wasn't mirror checking so much, or I felt a bit more relaxed in myself. But everyone's new information will be different. And some examples for exposure response prevention for body dysmorphic disorder could be going out with slightly less makeup on, or perhaps trying not to do the makeup several times over, or wearing clothing that covers the features slightly less. But in therapy, the therapist will really help you look out for what BDD responses might crop up. And exposure is a really good opportunity to just practice stepping away from them. So mirror retraining. The idea of mirror retraining is to help people with body dysmorphic disorder develop a healthier relationship with the mirror. Reason being, what we see in the mirror is not necessarily accurate. And this is because there's a whole host of things that are reflected back at us when we look in the mirror. Reflection is one part, but also our emotions, so how we're feeling in ourselves, our mood, just where our attention is at, perhaps past memories. There's so many things that reflect back at us. We do need to take what we see with a bit of a pinch of salt. And additionally, if people look in the mirror in a zoned in way, they can miss the bigger picture of themselves. Sometimes an example I like to give is imagine a large, beautiful tapestry of embroidery. We could either step back and focus on the image, or we could go in and scrutinize for any missed stitches. And if we put our attention on perhaps the missed or the broken stitches, or where it's fraying a bit, we may miss altogether the beautiful, colorful image in front of us. So, mirror retraining can be done by setting parameters for mirror use. So we might suggest using the mirror for functional purposes only. And by this, I mean things like styling your hair, making sure your eyeliner's straight, for men, trimming your beards, or shaving to make sure that you're not cutting yourself or missing a spot. To try and see yourself as a whole, as opposed to zoning into areas of preoccupation or dissatisfaction, which links back to that tapestry metaphor I just mentioned. To focus on the reflection as opposed to the felt impression, because often what we're seeing is more how we're feeling in ourselves, and that can be a bit of a skill to master, but a therapist can guide you through that. Not getting too close to the mirror. We tend to see that people with BDD really zone in, get up close, to not use ambiguous reflections. As I said, you'd be surprised how many reflective surfaces there are in your house alone, whether that's the tap, your mobile phone case, and to not use the mirror because of an urge, not as an anxiety response. Stop using magnifiers or torches to shine onto your skin, for example, because no one else is seeing you under the scrutiny of being up close with a magnifier and a torch, so you're not giving yourself an accurate representation. To think about mirror avoidance too. Some people with BDD will steer clear of the mirror and get really anxious with it. So we look at building people up to being able to use it when they need to. We might also do an exercise where we'd practice describing your body using neutral terms and considering the functional use of the body parts as well. Just a nod to medication. And this is according to the NICE guidelines, which are just guidelines for any health condition in England in terms of treatment. So for adults with BDD, the initial pharmacological, basically medication treatment, should be fluoxetine, because there's more evidence for its effectiveness in BDD than there is for other SSRIs. NICE recommends it ought to be taken for 12 weeks to determine its effectiveness. If after 12 weeks there's been no benefit from this medication, a different SSRI should be offered. But they should be caveated that all medication ought to be discussed with a doctor or a psychiatrist, and they may have their own rationale in terms of what they prescribe, but that's what the NICE guidelines suggest. And just to wrap up my presentation today, I just thought I'd signpost you to a few useful resources. The Overcoming Body Image Problems, including Body Dysmorphic Disorder, by Professor David Beale and Dr. Rob Wilson, is a really useful book. I know it might seem unbiased, but I think that it's really good because it follows CBT principles that people would follow in therapy, and is a really easy read. The BDD Foundation and OCD Action websites have a lot of resources, including webinars. They've also got helplines and email helplines too. And the BDD Foundation also has a podcast called Beating BDD, which I believe has information from people with lived experience and clinicians as well. And I think the final word I have to say today is, if you feel you're experiencing BDD or distress or anxiety around your appearance, there is hope. But I worked with people who have begun to overcome this and noticing a difference in their life and beginning to be able to enjoy other things. So just wanted to end on a note of hope. And thank you for having me.
Brilliant. Thank you so much, Rebecca. We hope that was really useful for people to hear. We're moving on to our lived experience sessions now, and I'd like to introduce Mia Hill and Kitty. So Kitty will be interviewing Mia Hill about her experiences. Mia is a 21-year-old psychology student, part-time staff member at OCD UK, supporting young people with OCD. She's also a youth ambassador for the BDD Foundation and a member of OCD Action Youth Engagement Panel. I'm not sure when you have the time. Mia's been involved in fantastic media outreach, such as a Lad Bible Roundtable on BDD, the fashion brand Monkeys BDD Awareness Campaign, and Marie Claire magazine. Mia also runs a mental health page on Instagram, sharing her journey with BDD and OCD to raise awareness and help others through her own experience. Thank you so much. So over to you.
Thank you, Kath. So Mia, thank you so much for joining us. And after Rebecca's presentation, hopefully everyone understands what a brave step it is to be on camera and sharing your personal experience with BDD. So I thought I'd ask you a few questions. When did you start to experience BDD symptoms? And can you tell us a little bit about what that was like?
Yeah, so I've always said it was a bit of a gradual process. It wasn't something that happened overnight. And my first memories was when I was around 15, 16. And I remember it was the year I was doing my GCSEs and had a lot of big things coming up. And I started to have these preoccupations. And at the time, I didn't know what BDD was. I was already diagnosed with OCD. And yeah, so I was doing my GCSEs, which is a stressful time. My prom was coming up, and I kept on having these ruminations about my appearance. And it, at first, I thought it was just a normal thing, because I know, you know, it's a normal thing, especially for your teenage years, to have these worries about your appearance. However, it felt different, and I knew how it felt with my OCD, and they're kind of similar, kind of different, but the patterns seem quite similar. So I thought this isn't normal, and I knew when it gradually got worse and worse as time gone by that this is something different to than just having normal worries about appearance. So when lockdown happened, well, there was one instance actually on my prom, which was like a big instance, which is I got all dressed up to go. And I feel like this is one of the first times I started to engage in compulsions around with BDD. And I filmed myself in my prom dress, everything all done, my hair and makeup. And I was walking up and down and turning. And I just remember looking at a video and analysing every frame. And this wave of anxiety came over me. I felt really panicked, didn't know what was going on. I was just so fixated on my face, primarily my side profile, just zooming in to my forehead, and then my overall body. And a bit like Rebecca was saying, it was almost like I was zooming in to different aspects of my body and not seeing myself as a whole. Anyway, long story short, I had a panic attack, and I didn't end up going to my prom because of it, which is, you know, I didn't really understand what was going on, so I didn't expect my parents knew what was going on. But I do have anxiety anyway, so people just put it down. It was just too much. Anyway, time went on during lockdown, which is tough for everyone. I think that was the time where it was just 24/7, like we all were stuck inside. I had my camera there the whole time, and I just remembered I just kept on reaching for the phone, having to take photos of myself, video myself, and then just spending hours analysing afterwards, feeling extreme anxiety, you know. And the more I did this, the worse it got. So the more I engaged with these compulsions, the more came. So reassurance was a massive thing, and at the time I didn't realise that was a compulsion. So asking my mum, people around me, and the weirdest thing that I did was, even if they gave me a simple answer, I would spend hours analysing how they said it, the way they said it, their face when they said it, you know, everything, and just sort of turning it into it's not, you know, that I am disgusting, hideous, whatever BDD was telling me.
Yeah, thank you, Mia. And I'm sure so many people with BDD could actually relate to some of those examples you gave. I know it can be really difficult to talk about, but for those watching who might be in a similar position right now, and I know that you mentioned the prom example, but what would you say was the hardest part of your BDD experience?
Yeah, I think it was the isolation, and I mean, gradually as it got worse and worse, there were particular times where I would have really dark thoughts, and my first thought, suicidal ideations, which was really shocking to me, and I didn't know how to deal with those thoughts. Aside to BDD and how it made me feel, it was like, oh my god, these thoughts are really scary. What do I do with them? But knowing that the reason why I was having those thoughts was because of my appearance and how it made me feel. And I think there was shame and embarrassment alongside that, because, like I said before, I knew it was BDD. I just thought, but this is just so weird and bizarre. Why am I having such extreme anxiety and feeling such a horrendous way over these thoughts I'm having about my appearance? And I think that was another thing, was the shame and the guilt and just the isolation. I think the longer it went on, and especially it was in 2020 in lockdown, the worse it sort of made me feel. And I think, like I said, got to that point where I had suicidal ideations, and it was very, very scary.
Yeah. And I'm wondering, how did you initially reach out for more support during that time?
So like I said before, so I have OCD as well, and just before lockdown I started treatment again with CAMS, so it moved to Zoom, so I was having sessions now and again over Zoom, and I think the same thing happened with my OCD is what happened with BDD, where you get to a point where you don't care necessarily if people think you're crazy, or if you think, what's the worst that could happen, because you've gotten to the point where you feel like it can't get any worse. And that's what happened when I first started talking about my OCD. I didn't know what OCD was. Sort of the same thing happened with the BDD, and I just thought, I don't really care what happens, I just need to tell someone. And luckily I was in therapy for OCD, and so I started to explain how I was feeling, and still kind of embarrassed, sort of still didn't really know how to explain it because I didn't even really have the words, but luckily, and I'm so thankful that I had that my therapist sort of kind of knew what was going on, and sort of suggested that it could be BDD, which is where she led me to BDD Foundation, which saved me, and so many different resources. But it was my therapist at the time, thank God, that led me to that road.
So you've mentioned your therapist, but what would you say has helped you recover or make progress with your recovery?
So therapy is great and amazing, and I think ERP was the thing that really helped, and what I still do on a daily basis. But truly, I think it was the community side, and finding others speak about BDD, because you can be told that you've got a disorder, but until you see other people speak about it, it can make you feel like, I remember thinking, I haven't got an illness, I'm just this hideous, disgusting, disgraceful, blah, 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 all these horrible things that it was telling me, and not being able to accept that it is an illness. And so seeing other people talk about BDD, and now I know that everyone's experience is different, however there's so many similarities and all that, so being able to hear people talk about very specific things that I was going through was like, okay, maybe it is an illness, and actually being able to accept that it is an illness. And I think just hearing lived experiences, people's lived experiences was a really incredible thing that helped me, and just being a part of that community. And like I said, to the BDD Foundation, sorry to embarrass you, Kitty, but just incredible resources, and being able to be a part of that community, just I think absolutely life-changing, and one of the biggest things that helped me in my recovery.
Well, that's wonderful. It's not embarrassing at all, because the BDD Foundation's got such a wonderful community, and that's something I've experienced myself. So thank you for saying that. Can you share something that was particularly powerful that you've learned through accessing support and treatment? I know you've mentioned community, but is there something else?
I think there's so many different little things, big things that I've learned in therapy, but I think just how I approach things differently now, like how I see myself in the mirror, how I see myself as a whole rather than all these different aspects. And I mean, there was this one thing that we did in therapy where I had a little picture of me when I was younger, and the thing is, you can feel very detached from, because I feel like I am so distant from that little girl, and at that point when I was younger, she wouldn't care less about all these things, and she had so many ambitions and just lived life because she loved it and all these different things. And so BDD can really make you feel so worthless, and such a really low self-opinion. And I think if we just reminding myself that little girl is still in me, and she still has those ambitions and the things that she loves in life, and being able to sort of reconnect to that, it sounds kind of cheesy, but it really, really helped me. And so I do have photos on my mirror where when I'm getting ready in the morning, she's always there. So it's just little things like that really did help me a lot.
Yeah, I think that's wonderful because I think BDD squeezes out those ambitions and other aspects of ourselves. And so reclaiming that is just beautiful. So thank you. And I guess one of the final questions I would ask is, what would your message be to anyone watching this now who is struggling?
Yes. Yeah. All I can say is that I have been at the rock bottom and in a place where I swear to God that I thought I'd never be out of. And I'm here and I'm living proof that, and I'm doing a lot of different things now that no way, if you told myself when I was really struggling that I'd be doing it. I mean, the fact, I go to London now and I'm able to do, and like the idea of even walking out my house without any makeup on, or just at all, even with makeup on, or hiding myself in different ways, like absolutely not, would never have happened. And I think when you're at your lowest point with BDD, and I know how it feels, and I know that people can tell you that all these different things, that you're beautiful, you're stunning, or whatever, you have to be able to find that hope inside of you to be able to get to the place where you want to be. And so I always say, hold on to the hope. And again, it's quite cheesy and corny, but I promise you, just find these little glimpses, hold on to them through your recovery, whether you're going through therapy, whether you find a community, because it will be a journey, but it will be a journey worth taking. And if you can hold on to these different pieces of hope along the way, you will get to that place where, now I'm so different to that person that I was, like in lockdown, especially when I was really struggling. I'm so different from her, and I'm so glad I stayed, and I'm so happy that I continued my journey. So please hold on to hope.
Thank you, Mia. And we are so pleased that you stayed as well, because look at what a wonderful inspiration you are, and all of the amazing things that you've achieved just in the last few years is just outstanding. So thank you.
Thank you.
Yes, thank you, Mia. I'm sure that's been encouraging to so many people on the call. So I'd like to introduce our next guest, and Kitty is going to be interviewing Andy again. So Andy Hall is a long-standing BDD Foundation volunteer who's developed BDD in his late teens and has been in recovery for over 10 years. So we can celebrate that tonight as well. Andy's promoted hope for recovery by bravely sharing his experiences with the community on numerous occasions, most notably at the BDD Foundation conferences, webinars, and Beating DDD podcast episodes. Fantastic. So look forward to hearing this. Over to you, Kitty.
Hi, Andy. Lovely to see you again. Thank you for joining us on this warm evening. You're going to recognise some of these questions because I've copied them from the questions that I asked Mia. So if you're ready, I will start with the first question.
Yeah, absolutely. And just before you say it, I did want to say thank you, Mia. That was really brilliant. But yes, Kitty.
Okay, great. So when did you start experiencing BDD symptoms, and can you tell us a little bit about what that was like?
Yeah, so I mean, I grew up in Salisbury in Wiltshire, and my experience of sort of going to single-sex schools primarily, and was definitely a big part of where I think my BDD sort of stemmed from, and my experiences of the kind of culture in that town and those environments I was in, and for me, I started to notice, I think, around the time I was 14. I had throughout my experience of school, I was very severely bullied in relation to my ears. I had very sort of sticking out ears as a kid, and I can remember thinking that the bullying wasn't that bad. I think because of normalizing, right? And then as time went on, I think it kind of came to a head around the time I was 17. When I would have first noticed, that's not quite true, not to a head, but it began, I began to engage in kind of rumination behaviors and checking and so forth around that time. And it was interesting, I think, thinking back, because I can remember like when I was 17 was when the first iPhone came out, right? So social media really began then, Facebook, that kind of thing, eventually moving into things like Instagram. So there was a lot of focus on this sort of like the image in a new way, right? In terms of posting and I'm not sure editing is quite the right word in terms of like a technical sense, but certainly in terms of how me and my peers would sort of present ourselves online and in person as a result. And I think that was around the time where I had my first surgery on my ears, and I ended up having two, a second one at around 21, and that was the third sort of period where I'd say the BDD started to really, where it did come to a head at that age. And I just realized I might have gone beyond your question. Yeah, so it was kind of those distinct stages, sort of 14, 17, and 21, I think, were the big points of where it kind of began and then sort of started ramping up.
Yeah, no, you didn't ramble on at all. That was fantastic and really helpful. And as I said to Mia, I know it can be tough bringing up those memories of the experience of BDD, but if you felt able to share, what were some of the darker times that you had with BDD, so that anyone who's in that place right now might be able to relate to it?
Yeah, absolutely. I think I mentioned the culture and the context of which I grew up, and I say that very purposefully because I didn't know that I was experiencing a mental health problem because there wasn't the language to discuss it. I think that it was a different time in the noughties anyway, but I think that thinking of stigma, and I felt very, very isolated, and I remember reaching out to certain people in my life, like my family were brilliant in the best way that they could be, but we didn't have the language then. So it was a lot of, I think, as Mia put into words, sort of isolate. She may not have said these exact words, but isolating myself and feeling very much like zooming in, right? Hyper focusing on what I perceived were flaws. And at its worst, that involved, like Mia said, I had, experiences of suicidal ideation. And I, around 21, and this is a really important point, I think, because it shows the trajectory of how things got worse, but then got much better. So I at 21, I had gone to university very briefly for one term, but had to come home. I was just too unwell, and I was spending up to 8 hours a day going from like bed to mirror, and I had no idea what was happening. Kind of funny looking back, I remember thinking even just a few years before that I was just a little bit more sensitive about my appearance than others, and that might have been something my parents said in a way to sort of try and comfort me, but I really believed it was true, that like, oh, this is just normal. And then it got to like the worst part, where I was, I said, feeling suicidal and feeling very, very just, I suppose almost like off track compared to what I perceived everyone else was doing with their lives. And I became a voluntary inpatient for a short period. And it was quite hellish at a point, but I think that point of really accepting help for me, and I don't want to jump ahead, but that was the hardest times then led into the recovery.
Thank you. Yeah, and I think you've really demonstrated and explained so well how it can just ramp up and suddenly it's overwhelming. And you mentioned that you did manage to seek some help.
Yeah.
How did you make that step?
Well, I think that I'm very conscious that obviously I can only speak to my own experience, but I think for me at the time it was the sort of the several factors came together. I mean, I mentioned that I was briefly at university the first time round, and that was I think sort of 19 to 20. I had a sort of a gap year to start with. Anyway, so I was there at 19 to 20, and while I was doing my sort of shuttle runs from bed to mirror, when I did manage to go out, I remember speaking to a friend who I'd made there, and she said to me, "Have you ever heard of body dysmorphic disorder?" And I had no idea what that was. I'd never heard of it at all. And I can remember going back to my room, and reading the Wikipedia article, which again, it's not necessarily the most scientific, But still, and I remember thinking, this is me. And it was both horrifying and so relieving, because I described it at the time as like putting a name to the beast. I finally could see that this wasn't it wasn't inherently me, it was something I was experiencing. It was an illness. And I think I managed to be more compassionate to myself from then on, because I could go, even though it was horrible to think, my gosh, I've got a mental illness. It was also, it allowed me to think how, maybe just something about how we treat people who are unwell. And by allowing myself to be unwell, I think I remember speaking to my GP at the university. I remember speaking to my family and opening up to certain friends, because I think my GP at the time gave me the diagnosis, or at least provisionally anyway. And then I began opening up more and more and building, as Mia said, this network of people. It took a lot of time, but then that led me to then trying medications, to then trying CBT, and eventually I was able to access some specialist CBT for BDD. We love an acronym, don't we? And then and it was absolutely life-changing. Exposure and response prevention, as Mia said as well. That was the ticket.
Yeah, well, that leads really nicely on to my next question, which is about treatment and what really helped you in your recovery journey. And I guess also if there's anything that you continue to practice today to keep you well. Absolutely.
I'm just checking my notes. But yeah, no, I think it's really important for me to again, I've clarified the CBT, the specialist CBT. I think CBT in general was useful for me because I think that, life is, there are so many things that can affect us simultaneously, right? I mean, I identify in terms of my sexual orientation as a queer person, and I choose that term quite deliberately because not being in a box, and that started through CBT for me to sort of explore this just myself more, and then led into more of an understanding of how these different, how body image and kind of sense of self can relate and so forth. And then from there onwards, as I was being referred to the specialist CBT, I found that that medication gave me the lift, excuse me, to accessing the therapy fully. And it wasn't I probably tried, maybe half a dozen medications over several years before I found one that worked for me. But I think for me, if I were to say to myself again, give myself advice on what might be helpful, it's to give it a go, perhaps, if that felt like it was the right thing to do, and to if it wasn't working, then I remember telling myself, okay, we'll try another one and try another one, and in the end, I found one, as I said, that was helpful, that allowed me to move into the BDD. Obviously, I can't give medical advice, but that was my experience. And then from there as well, I think there was sort of I very much, I think, was in a position to educate myself through not just the therapy, but kind of over time, to think about, learning about BDD, I ended up going and doing a psychology degree, and learning about biases in the brain, how we have a negativity bias. I think it was at one of the BDD Foundation's events. One of the speakers was saying about, how if we go to a shop and there's 10 members of staff, 10 different shops, and one shop, they're rude to us, who do we go home and talk about? And things like that really stick with me, because it makes me think, actually, this isn't necessarily something I'm choosing to do. There is a psychological component, perhaps, but I can be aware of it, and I can perhaps be mindful and work on, I wonder if this is what might be happening. So yeah, ongoing, I guess, learning and about myself and my brain and so forth.
An ongoing thing, learning about our own brains.
Absolutely.
So is this something that you might be able to share with everyone watching this evening? Something that was particularly powerful that you've learned through accessing either, support, so that could be community or treatment itself?
Absolutely. I think that for me, I mentioned, well, I don't think I actually did say, but I was, like Mia described, I was absolutely certain in my beliefs, right? I was so convinced through my own, evidence, which wasn't really evidence, through my own experiences, right? Through my own lens, I thought, well, these are facts about how I feel I am, and how other people therefore must think of me. However, I've learned over time in a very powerful way to be able to change those beliefs by sometimes noticing, for example, like I've had wonderful experiences that have stuck with me. So, for example, spending time with friends. And I remember asking this one friend, are you okay? And she just said, I'm just really, really conscious that I think my hair looks terrible. And I remember thinking, not only did I not notice that, but I actually thought it looked really nice. and those moments, as time has gone on, there's been more and more of these things. And I could go on and on with examples, but it just really helped to show me that a lot of the things that I had come to believe were true based on media depictions, based on narratives in my social circles about what kind of is and is not attractive and all this kind of thing, were complete rubbish. Like there's, I guess, with all things there are maybe elements of truth if you dig in deep enough, but I had severely overestimated this one perspective, right, from this little town in Salisbury. and actually learning that, I guess, the to go back to the question about what have I found particularly powerful is time and learning through experience that I can change my perspectives and my beliefs, and that so many of those that used to affect me so severely now very rarely do, if perhaps don't at all.
I think that's lovely. And I think, in the last two answers, you've mentioned somewhat like the passage of time, and that recovery is a process and it's not linear. And sometimes we do have to take that bit of time either to find the right medication or to be able to really throw ourselves into the CBT and the exposures. But, it takes time for our mind to heal and progress. So it's lovely how you've expressed that kind of across both questions.
And if I may just add one last piece to that, is that I'd also realised that blips are normal. Recovery is not linear. I remember learning from someone that we often think of recovery as this kind of line, right? This upward line, but actually maybe it's a spiral that can go upwards and continues. And sometimes it sort of wobbles around a bit. Maybe we have a bit of a low, or maybe we have a really big low, but then it continues as life goes on. It's not necessarily this kind of like boop, 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 boop. And there was just something about that for me that felt so freeing. This idea that, I guess, to go back to my earlier point, that learning to change my perceptions and how I conceptualize things as well. You don't have to accept a particular metaphor or whatever. Like, you can choose, because I think perfectionism and kind of very black and white thinking is something I've been particularly prone to. And over time I've learned to say, actually, I'm not sure that way of thinking works for me. Maybe I'll think about it this way. Sometimes it works, sometimes it doesn't, but you get to change your mind. And I think I found that can get easier with time and with support.
Yeah. And I think that perfectionism can sort of transpose onto the recovery process itself. And you can be like, why am I not getting better?
Right. I can't feel unwell again, ever. And then I go, oh, hang on. Would I say this to someone I loved, to someone I cared for? Would I be that black and white with someone? Because no, life can be challenging, but it can and does get better, I think. Yeah.
Yeah, thank you. So one of the last questions I'll ask you, but we've got a bit of time, so feel free to.
Yeah. I've been working very hard to be very succinct, so I can certainly expand.
We wanted it so much so that we're a little bit ahead of time. But what would your message be to anyone who's struggling right now?
Well, I think that, as I've touched on this idea of how things that beliefs can change and experiences can change, and that there is a freedom, and as I said, in accepting that. I mean, there's not to suggest any particular treatment or approach to anyone, but just to speak to a therapist that I really like, called Dr. Kristen Neff, and she focuses on self-compassion. That this idea that actually, it's okay to accept, for me, that that suffering to some degree is a part of life, but it can pass, right? And that that it's a shared experience for all of us at different times. That so many things that I think I used to believe, that I'd see somebody on a magazine or TV and I'd be like, almost like this calculation in my head, that I'd be like, oh my gosh, he's got this and this and this and this, and I'm perceiving that as like the perfect whatever, therefore that person is going to have this amazing life. And I've just realized over time that speaking to people or seeing stories of people in magazines, on the internet, in life in general, that actually I'm putting my own spin on things that often it can be wildly untrue. And the reason I mention this is because I think it's this idea of, if I can change those perceptions about other people, I can also change my perception of myself. And that is something that I have really learned over the last sort of 10 years or more. I think it's close to 12 now. This idea that I know now that over time, and with continued recovery and practice and riding that wave, that I am far less harsh on myself and on others, right? And not just less harsh, but less black and white, thinking that oh, this person's going to be this way, and this way. I've actually come to realize, what evidence do I have for that? If someone is doing well, fantastic, good for them. But what do I consider well? Do you know what I mean? And I mean, I went into work in social work for a few years, and I would meet people who on paper would have had it all, against perhaps the stereotype of people who I might come into contact with in that field of work. But I meet people and I think, gosh, if I were to see you on the street, I might think your life is perfect, but actually it's all about what goes on behind closed doors to some degree as well, isn't it? And I think that's part of the message I would send, is that connection and sort of and love and attraction, it transcends they transcend the narratives that I'd come to believe. Actually, like, as life has gone on, I realized that I love my loved ones for who they are, not how they look, right? And I try to apply it to myself as well, because I certainly know that I do that to others, and we all deserve that freedom, right?
Yeah, thank you, Andy. You touched on so many beautiful points there about self-compassion and reducing that comparison making, which I think is so common in BDD. But it's not just about appearance, it's about lifestyle. We can, think that someone looks good, therefore everything's together. So much more complicated than that.
Yeah.
But it's all about connection. So thank you so much for sharing.
That's okay. Thank you for having the space. I appreciate it.
Yeah, thank you, Andy. I'm sure that's been a huge encouragement to so many people. So we're going to have a break right now.
Hi, everyone. Welcome back. I hope you managed to grab a drink or something to eat. I'm now going to be joined by Rebecca, Andy, and Mia again to answer some of your questions that have been coming in. So I'll just wait for everyone to join me. Hi, everyone. Thank you so much. Your presentations and your lived experience shares were just fantastic. And we've had some really great questions coming in. So I will start. One of the questions that came in was, my child doesn't believe that they have BDD and they insist that they're ugly. How can I help them to see that this is BDD? And this is aimed at a child. I think it can relate to someone of any age with BDD. I might hand this to Rebecca first, but if Mia or Andy have any thoughts on it afterwards, feel free to jump in.
Yeah, it's a really good question, because I think often people with BDD do feel so strongly that it's a physical concern. I would maybe try and go more in the angle of I can just see how distressed you are, and perhaps take away the content of the appearance initially and say, look, I can just see that you're really upset and down at the moment, and perhaps just some support in helping with your mood and talking to someone could be helpful, as opposed to trying to tell them, no, you're not ugly. Can you just ask the question again? I'm just trying to think if there's anything else I would add.
Yeah, so it was about how to help a child realise that they might have BDD instead of just being ugly, which is someone with BDD often considers.
And I guess the other thing would be to perhaps, as Mia was saying about that sense of community, perhaps signpost them to the BDD Foundation, where they might see people and recognise similarities, and it might just help someone go, I thought this was a appearance problem, but there's other people experiencing the exact same thing as me, and I don't think they're ugly. So maybe there's something in this. I don't know whether Mia or Andrew, you'd have anything to add, sort of based on your earlier experience.
Yeah, I mean, I think for younger people, especially, I mean, when I was first struggling, and I also can relate this back to OCD. I think like when I was really young when I was diagnosed with that, and I think it's always hard. It was always harder to talk about when I was younger than it is now, and I think maybe that is experience, but I also think a lot of it is getting older. And I think, like you say, Rebecca, I think finding that community, and it is really hard to speak to your parents about it. It's hard to even try to fathom what's going on yourself. So I think being able to just go, on your own, or maybe with a friend or someone your own age, and just find that community in your own time. And I think, I think talking to your parents can be really, really difficult and challenging. I mean, I was a teenager. Like I said, I was 15, 16. And when I was speaking to my parents about it, it was really, really difficult. And, they didn't really understand it, and I didn't understand it. And so it was awkward, because especially if you're going on into, like, if it's preteens and then teenage years, that is a really complicated thing anyway. So parents might not necessarily understand. But I think, find that community, and maybe watch a couple of videos. And I think there's a lot of videos out there of all ages. And I think maybe find one of those could be quite helpful.
Yeah, and I think just to add to that as well, I think that I think thinking back to what I needed when I'm conscious I don't know your child's age, person asking the question, but I think that if you can be that safe space, for your child, and to be there for them, as and when they may feel comfortable talking about things and figuring it out. With your support, etc. It's so hard. Sort of almost, I think I remember almost snapping at my parents sometimes, because it can be a bit sort of like eggshells, like, oh, I need this, no, I don't want that, I do need this, oh, I don't, changing my mind because I didn't really understand what was going on either. But I think as hard as that can be, being that safe place that they know that they can come to and talk things through as and when they feel ready, I think can be so important.
Yeah, I think those are all really, really great answers. Thank you. And I'll give a little plug to the youth website of the BDD Foundation, youth.bddfoundation.org, which has got some videos of young people speaking, where maybe, like Mia said, they'll find something they can relate to within that. Another slightly more youth-related question, maybe I'm showing my age here, but how can social media affect BDD? And I might aim that at Mia first, the social media expert here, and then see if anyone else wants to jump in.
Yeah, I don't know about expert, but I dabble. No, I think absolutely. I think I've always said that social media was never the cause of my BDD, but it definitely exacerbated my symptoms. And I mean, I used to scroll down, compare, and all of these little things that I didn't think were compulsions. It was feeding the beast, it was feeding the BDD. So I actually I think when I started doing like ERP and therapy, would actually set timers on certain apps, and because the less I did it, like when I was cutting down on videoing myself and all these different things, the less I did it, the less I was reaching for it. So that's what really helped. But I mean, it is incredibly hard to navigate social media, because I feel like even if you don't have body dysmorphia, the average person will still struggle with their body image because of social media. I mean, I always said that again, the average person, you don't see the cameras that are behind the photo, the editing and the money put behind it. You know, maybe they might have, a lot of, especially celebrities, they have a lot of help. And that one photo that looks really candid has so much lighting and so many different things, but you don't see that. You just see a photo and you see, why am I not like that? So comparison is such a massive thing, and I think being able to spot that and sort of bring yourself back that actually that's not real, that's not reality, is something that I found really important, because now I look at social media and I know that that's the best version, and maybe not even the best version of that person. It is all these different things, and nobody in reality, in real life, is like that. And you know what? That's the best. That I'd rather have that than be that version that I've seen on social media, which is a hard thing to get to. I know, because at the time it's horrible, but it's that's what I'd say.
No, Mia, I think I'm right there with you. I think my BDD also didn't come from social media, but it was severely exacerbated by it, because I remember my parents said to me, we would finish school on a Friday and we wouldn't see our friends or like communicate with them really until like Monday. And this was in the world of landlines, right? Where my mum's parents were like, don't you touch that phone, it's too expensive. But like, you can just continuously, endlessly sift, can't you? But then what I think I've learned that helps me is reminding myself it is designed to be, right? It is designed to be algorithmically and the way it's presented, the color schemes, all of it. Social media is designed to be enticing, and I think about that kind of something that I found really, really useful is maybe like sitting on a bus and looking out the window, noticing the people my eye is drawn to, and then deliberately looking at everybody else and realizing that the majority of people come in so many shapes and sizes, but the people that I see on Instagram are the ones that algorithmically, it has chosen to show me because they are the pictures with the biggest hits or whatever. But again, those same pictures are going to be, I've even met an influencer who has shown me the copious photos before the one that they chose, and that they waited for the lighting to be just right, and all this kind of thing, and there's so much more than just that snapshot, which our brain goes, I don't like that. But there's a whole story behind it. And yeah. Social media, eh?
That's great. Rebecca, was there anything that you wanted to add? No worries if there isn't, but I thought I'd check in.
I suppose just that it's a platform for added preoccupation, isn't it? Whether that's in terms of comparison or thinking about how to shape your own profile media profile, whether it's feeling preoccupied about, does this photo look okay, or how will other people think? And absolutely, I don't think it's the cause. I think BDD was around well before that, but it's so accessible as well. I think you can realize you've opened Instagram before you've even thought about doing it, can't you? So absolutely, I think beyond that, nothing to add beyond what Mia and Andrew have said.
Because it just sounds like mindful use, being aware that filters are used, people showing like their best self, and it's not always reality. I think that's so helpful. So a question that's come through is, it sounds like it's someone who's going through treatment at the moment, and they're asking, will I have to keep working at my BDD recovery after I finish therapy? I might hand that to Rebecca first. I know you just finished, but I might hand that to you first and then see what the others say.
I would say it probably needs some mindfulness ongoing after therapy. And I think, as Andrew really succinctly put it, the journey is like a bit of a spiral, and that can be even after a course of therapy. I think you need to be perhaps on the lookout. Often therapists will do what they call like a relapse prevention plan with you. So putting into place things that might trip you up or to look out for. And I think it varies from person to person as to how much mental energy they need to put into keeping on top of it. But I think the good news is it's certainly it's certainly, once you're out there, the thick of it, not going to be as energy consuming as it is at the start of therapy. I don't know whether that perhaps matches your guys' experiences.
Yeah, just to speak to that, I think that something that was really quite life-changing for me was realizing that how I conceived how I thought recovery needed to be was almost like a symptom of my obsessive thinking. I thought it's got to be 100%, it's got to be perfect. I don't want to feel ill ever again. I don't want to ever have to feel like this. Actually, I realized that it's like a backpack, right? When I was at its worst, it was like a backpack full of bricks that was like weighing me to the ground. But now it's like I barely notice it. You know, it is something that I experience time to time. But I suppose it's like, you know, sometimes when you're like, you know, where are my glasses? Where's my watch? Where's my whatever? Oh, I'm wearing it. It's kind of like, oh, yeah, I guess I've just remembered that that's something that I sometimes deal with. But it's just not at the forefront. That this is my experience over time, you know, and through therapy and support and so forth, is that actually, yeah, I need to work on it, but it's as you said brilliantly, Rebecca, it's just not in the focus as much anymore. It's just sometimes I'm like, it feels like I'm kind of taking care of myself in a way that I hadn't known how to do before, and yeah, and it's not like it's all or nothing.
Yeah, I think I would say, just to add that, I think it, for me anyway, it's almost like I'm taking medication every day. I feel like every day I'm doing little things, like my ERP, but they're tiny little things compared to what I was doing when I was first in therapy. It's almost like I'm, for me anyway, keeping on top of it. Taking that pill once a day to sort of keep it at bay, but it's just little tiny things, and it could be one, you know, just even if it's like doing, like I said earlier about having that photo on my mirror, little things like that I feel just help. And maybe I don't need it, but if it's working because, you know, I'm able to go about my day-to-day life with that voice not being there. You know, it's in the back seat, you know, and it used to be in the passenger seat. So
thank you. And yeah, I think I'd just like to add, you know, relapses can be really, really scary. And when you have one, you can feel like you're back to square one. But I think the interesting thing is the neural pathways that you've started to build through CBT, they're still there. They're just in the waiting for you to practice them again and, you know, get back on that path to recovery. So you're never back to square one, no matter how much it feels like that.
Kitty, may I just speak to that one very quickly with a little, I don't know if it's not a metaphor, but someone said to me once that feeling like we're back where we started is not the same as having never left. And I love that expression, because, yeah, I just think it speaks to what you said perfectly.
Yeah, thank you. So this is a question for Andy and Mia. How can family and friends best support someone with BDD?
Go on.
yeah.
Go on,
It's too much politeness going, isn't it? It's just like people.
It's very British here, isn't it? We're like, no, after you.
Yeah, it's just painful, I have to say. No, yeah. So parents. I think it's education. So, like a lot of things, being able to understand it. I think there's parent guides as well, because it's that relationship between you and your child is really, it's unique and it's different to every other relationship that you might have, and especially if I mean, I think all ages, regardless if you're in your a child, teen years, or adult, I think that your parents are always going to be there to support you, and that support is necessary if you're close to them. And for me, my mum and I, we're like best friends. So she's been throughout my whole journey with my mental health when I was first diagnosed with OCD at 11. So, you know, been in and out of therapy with me. And when this came along, this lovely, horrible beast of BDD came along, it was new and it was sort of shocking. I didn't really know how to deal with it. And I think what we both did was educate ourselves. And then, I mean, I didn't know. And I think when my therapist said it sounded like BDD, I tell my mum everything. So I sort of explained it to her, and she was actually really confused and didn't understand to begin with. And she always used to say that I kind of understand the OCD because, you know, the thoughts are irrational, but with this, like, I don't get it. This is not my words, it's hers. She'd go, you're beautiful, I just don't get it, you know, that, you know. And then the more we sort of researched it, the more she understands, and now she gets it completely, and comes to the conventions with me and conferences, and she's like a part of it. I think it is, for me anyway, education and being able to share resources, and even if they need to read it in their own time, like my mum went off and read a lot in her own time, and then she sort of was able to not come to terms with it, but be able to sort of understand it better. Yeah
I think that's really beautiful, and I think that from my experience, I think that a big one to just be mindful of is you know, how certain questions are asked, right? It's absolutely, you know, it's absolutely very important to be, you know, curious, I think, about, you know, what's going on, because it's your child, right? You know, it's your loved one. I think that it's also important to be mindful of how certain questions are asked. I think it can be useful to avoid the why questions, because they might be perceived as accusatory. I mean, again, it's very normal to ask why questions, but I think it can be helpful to maybe consider that. And also, I think that, you know, I'm thinking about what it might be like for a parent or a carer, is that, you know, I think it's worth saying it's important to look after yourself, right? Because it's really, really hard, you know, when you don't necessarily know what's going on. And I remember my mum saying to me once, and I was having a really bad BDD blip. This was when I was waiting for therapy, and my mum giving me like a big hug and being very upset and crying and saying, like, I wish I could just fix you. And it didn't say it in any way that was insulting to me, but I could hear how much she wanted to be able to just make the BDD go away, and that isn't, I think, within our power necessarily, as you know, from a caregiver perspective. But that doesn't mean that that's wrong or bad. It just means that, like, you know, I think it's about, as I said before, providing that safe space, that, you know, where that, you know, if when you can, if you can gently kind of, you know, help the child to understand the support that is available and what can work, and to support them in that up and down, round and round journey of kind of getting there. And lastly, I wanted to say as well that, I mean, I remember one of the most, this is perhaps an extreme example, but like, I remember once, you know, when I was really, really struggling and very distressed, I sort of locked myself in the bathroom, and my parents were like, listen, you know, they were sort of, they didn't threaten me, but they were sort of, they ended up, you know, they called 999 and so forth, and were really conscious of my safety then and there. And there are times when that can be really helpful too, you know, I guess using that parental authority in a way with sort of safety in mind, and that you know, in hindsight, that really helped me. I guess it's kind of, there are shades of grey to all of this, but I think the consistency again of just being that safe space is key.
Thank you both. So, you know, to summarize, I feel like there was a bit of education. You know, it's a confusing condition for people to understand if they're not living it, and it's confusing when you're living it as well. So accessing, you know, the resources and the education out there, but also, you know, if you're a family member caring for someone with BDD, you know, you need that support yourself. And I know OCD Action has a wonderful support group for parents of people with BDD, you know, and there are lots of resources to, you know, reach out for more information on the condition. Rebecca, I've got a question for you around reassurance, which is something you know, mentioned in your presentation. Someone's asked, can I reassure my partner that they look good? How would you manage that one?
I think it's a really tricky one. I think as a general rule of thumb in BDD, we tend to want to steer people away from reassurance. But I think often that's something I'd gear people up towards during the course of therapy, and perhaps explain why we don't want to engage in reassurance. But if it's someone who's perhaps not stepped onto that therapy journey yet, that can perhaps feel quite distressing. I would perhaps still encourage to try and steer away from that. Let's have a conversation of, you know, perhaps I've mentioned, so I'm trying to think of my words, perhaps having a conversation with them that, oh, I seem to be noticing that I reassure you lots and yet it's still not seeming to sink in. Is this really helpful? Then perhaps redirect them to further support. But as a general rule of thumb, we don't want to be reassuring people, but I appreciate as a family member when someone's in distress, that can be really tricky not to do because it's so instinctive, particularly if they're not quite understanding why you're not giving them that reassurance. So perhaps caveating with, I'm not giving you the reassurance because I believe you don't look good, but just from my understanding of body dysmorphic disorder, that this isn't helpful in the long term. If that makes sense.
Yeah, absolutely. And maybe thinking about, is there another way that's not appearance related that they could show support, maybe a hug or, negotiate that with their partner? Would that work?
Absolutely. We talk about giving, encouragement and support and love without giving reassurance. So, it's absolutely fine to say, like, I love you and I care about you and I'm really sad that you're in distress and come here for a hug, and is there anything that we can do to take your mind off it, without having to get too much into the content of you look good or you don't look good.
Yeah, that's great. That's perfect.
Kitty, may I offer a quick add-on? Is that all right?
Yeah, please. Trying to get through loads of questions, but please.
Yes, of course. No, I just think with this as well, it's something to also consider is that I think having been someone who was reaching out at times for support, for reassurance of BDD, through this support that I then accessed, I learned to be able to reassure myself that actually maybe this is a BDD behavior, and coming to that sense of actually I feel very content in my appearance the majority of the time. And I think, please, Rebecca, correct me if I'm wrong, but I suppose that for me have felt like the progress I needed to get to was that I didn't need to get that externally or through checking, reassurance seeking. Over time, I'd be able to say, yeah, I feel comfortable in my own skin most of the time again. And that some degree of body dissatisfaction is normal because of the world,
Yeah.
So there's so many questions and I'm conscious of time, so I'm trying to pick ones that I feel are most important to cover. I'm going to put this out to the group, but I will start with Rebecca actually. What advice would you give to me as someone who's tried a lot of medications, therapy, and is battling to be able to get funding or specialist treatment for BDD and is finding daily living difficult and losing hope? I know that's a difficult one, but it felt like a pressing one.
Yeah, absolutely. And I think, so sorry that that's been your experience. I think, unfortunately, it is perhaps not as understood a condition as some of the other mental health disorders. What I would say is, even though it sounds like you've perhaps not had much luck with the NHS so far, still keep pressing with that. There may be one clinician who's just a bit more clued up or clocked in to not give up. And even in the NHS IAP therapies, people do have training on BDD treatment, even if it's a non-specialised service. I've done some of the trainings with a couple of the universities. So I would just say don't give up. But also coming back to what seems to be a bit of a recurring theme is find that sense of community. Even if you can't find therapy per se, use the resources on the BDD Foundation website. Perhaps get the Overcoming Body Image book. Perhaps do some self-help work while you're in this limbo phase. But I really understand how tough it can feel, and not everyone can afford private treatment.
Thank you. Is there anything that Mia or Andy you'd feel able to speak to on this? Maybe something around hope or, daily living?
Yeah, I think like what I said earlier about finding these little glimmers of hope, maybe writing down like things that's taken away from you and things that you want to get back out of life, and trying to find, things that you used to find happy and was your passions. I think try to hold on to those. And I think, and also the community side of things. I mean, it's very powerful what community can do, and be able to find that can be a bit tricky. And I think once you know how to, it's really good and helpful. And I think there's some on Instagram, and I know of the BDD Foundation, and I always say go back to the resources. And yeah, I think it's just temporary, like at the time being, try to reach out to people who are in that community, or maybe people that may post about recovery and they're in a different place, and you might feel like you could DM them or something like that. But yeah, just I say hope is the biggest thing, and I know that if you feel hopeless when you're at your worst, so just try and find those little glimmers of light and hold on to them.
I agree, Mia. Yeah, I think that I try to remind myself during my recovery, and again, I don't want to sort of scare anyone with sort of timeframes, because my experience of waiting times was 12 years ago, things in a specific NHS trust and so forth. And I at that time it was I was on a 2-year waiting list, and I remember at the time thinking that felt insurmountable. But then with time, I would remind myself, I had a bit of a mantra, purpose, not appearance. And I found that I would do things like, it was really hard sometimes, but I volunteered at like a British Heart Foundation charity shop. And I loved it. Like, it was not easy. I was like, just pop in the changing room, look in the mirror, like it was, I was still working through it. But building those connections with people, even little things. I have a really close friend of mine who describes like there's little activities that really help her. Like, she calls it just tidying the sock drawer, or like when I was just steaming the clothes in the charity shop. It felt like maybe I could have done that yesterday, but I'm here today, and I was working towards something.
Thank you. Is there anything else anyone wanted to add, or no?
I suppose just sort of on that note, I think when things were really hard, and it's hard not to think about the future and how long will this all take, to just take a one day at a time mentality, that what small thing can I do today that might make me feel a bit better. And that might be, as you say, something productive at home, like try a new recipe, or watch a nostalgic TV show, or paint my nails. But think, what can I just do that's small to get me through today, and then tomorrow we can deal with tomorrow.
Just one more while we're at it, why not? Is that I think being aware, and I know that sometimes comparison, either way, negative or positive, can sometimes be unhelpful. But I think for me, I can personally find it quite useful over time. I remind myself that, like, okay, so I am struggling today, and maybe I've struggled for a whole week or more, but there would be moments where I felt better, and I'd remind myself I do have tomorrow, right? And this is a treatable illness, and I would remind myself a lot as well that my comparison to others who I was at the time, I was thinking, oh gosh, they're all at uni, all my friends are all working, they're doing things I'm not doing. But then I think in hindsight, I remember realizing that actually it's just not a rush. These time frames are arbitrary, right? And there can be so much pressure. But like, I would say that in the, I call it my gap half decade. I spent basically 2 to 4 years sort of just in various stages of recovery. But like, I don't feel now, 10, 12 years later, that I'm any less I'm not far behind compared to others. I consider myself to have a very full life, a really full life. And I think that I hope that's an example of that, even though as you described it, Rebecca, that kind of limbo period, it can be so hard. But I think taking the pressure off yourself and realizing that, your recovery is what matters most, and that, there are ways to live fully in the, as much as we can during that period, but also, life can continue and be so rich, through recovery and in time as well.
Yeah, I think that's, go on there, sorry.
Add again, I've got it in my head, I feel like I'm going to mess up now, but I just want to say that these feelings are temporary right now, and it's not a question of if I get better or I might get better. It's that you will get better, and it's just at the moment you're in it, but it's to just hold on to actually, you know, when I start treatment or when I go through that, I will get in recovery. It's just not right now, and that's okay.
Yeah, and sometimes being in it is a result. You know, when we're in it, right, we lose those metaphorical rose-tinted glasses. I have to remind myself, oh, I'm feeling so rubbish, and I'd be like, oh yeah, because I'm still unwell right now, you know, and this is almost that was a product of those times. And you know, to the person who asked about how, you know, like longer term maintenance, there are, you know, very rare times now where I, you know, have a little kind of blip. It's arguable, is it even BDD now, or is it just regular life kind of body dissatisfaction, as I say, which we all get to some degree. I think I sometimes remind myself, oh, maybe I'm feeling a bit hard on myself because I've lost that kind of rose-tinted glasses right now, but I'll get it back. I'm in it right now. But what are the things that help me? What are those tools, those resources that don't have to work every time? But, you know, for example, you know, are there things that I can go back to, things that help me to feel calm and safe and relaxed, and, you know, that I've learned that over time can be useful in harder moments.
There's so much there, guys. Thank you. I think that's so important. And you've all touched on different aspects. And, you know, Rebecca, you were mentioning about, you know, with BDD, sometimes you want to do that volunteering, you want to get out of the house, but that's really hard. And I think, Rebecca, you pointed on the fact that even if you're stuck in the home, if you can take any time away from that BDD preoccupation, if it's to do something you love, whether it is, you know, something cooking related, or, you know, with BDD, maybe it's something creative related, because Rebecca, you mentioned that link as well. Anything that takes time away from that BDD is a win when you're really struggling.
Sometimes we encourage people almost doing a timetable of the day, just to be like, right, I'm going to go from this to this to this. So it gives a little bit less space for the BDD to jump in. And I've got a plan, and I'm going to stick to that plan as best I can.
Yeah, I think that's really great advice. And I was just about to round up, Kath, and you jumped on. So
Yeah, no, it's just really to add my thanks. You've obviously summarised it so well in terms of everything that we've heard. I just thank you so much for the wisdom that you've shared, the experiences that you've had the courage to kind of tell your story, and I'm sure it's just an incredible encouragement to everyone that's heard it. I just want to remind everybody here that the recording for this webinar will be available on both the BDD Foundation websites and the OCD Action websites in the forthcoming weeks. And also for all your questions that are still to be answered and all your kind of future needs, please do access the resources and the helplines and the support that is available via the OCD Action and BDD Foundation websites. They both have email helplines. They both have OCD Action has phone numbers as well, and support groups and all that, but go to the website to find out the details rather than reading out email addresses here. And just thank you so much to the panelists, Kitty for facilitating so brilliantly, and Mia, Rebecca and Andy for sharing so well. So thank you everybody, and I hope that was a valuable time for you all.